Good night and welcome to another edition of In Touch right here on Choice TV. We are streaming live on www.choice39.tv. Tonight our program will be just as interesting and we will be focusing on informing you on St. Lucia's response to the Ebola outbreak. Last week we had the Minister for Health, Honorable Alvina Reynolds, and we also had our Chief Medical Officer, Dr. Marlene Frederick, speaking on the role of the Ministry of Health in coordinating St. Lucia's response and ensuring that the relevant authorities or agents were informed and were equipped to respond to any possible cases of Ebola in St. Lucia. Last week, you would have heard the Minister for Health refer to agencies such as SLASPA. You also heard coming from the Office of the Prime Minister an announcement that there would be in place travel restrictions for nationals coming from the 3 affected West African countries, as well as an additional layer of security for individuals coming from Nigeria. Tonight, this program will place into context the actions taken by the government of St. Lucia so far. We will also be speaking to direct representatives of SLASPA, of Immigration, and importantly too of the Customs and Excise Department. At the end of the program, we hope that you would have gotten a better sense as to what the responsibilities of each of these agencies are, where we are in terms of our preparation, and also at the end you would get a better idea as to what still needs to be done to ensure that St. Lucia is in a state of readiness to respond to any possible threats of Ebola in St. Lucia. I want to waste no time and welcome to the program, who is right here to my immediate left, Mr. Andy Fenelon. He is the Controller of Customs in St. Lucia, and he will be speaking to the specific role of his department. Good night and welcome to the show.
Nice to hear.
We also have in studio with us, he is no stranger to television. In fact, he is the front individual when it comes to matters related to our seaports, and he's also a very regular face in dealing with disaster preparedness and disaster management issues. And I welcome Mr. Kennedy Francis. He is the Chief of Port Police at the St. Lucia and Seaports Authority, and importantly, you are the chairperson of SNASPA's Disaster Preparedness Committee, and so it fits very well into our whole discussion and into your role tonight. So I welcome you as well to In Touch.
Thank you, G.
We will at some point. We do not have a representative in studio, but today I was able to speak with a representative from the Immigration Department. And as we go through the program tonight and we speak on the state of preparedness, what is currently being done and what needs to be done, we will also be hearing from the Immigration Department. ASP Pelliu spoke with us today and will be speaking to the prohibition which is in place, how the Immigration Department will go about enforcing it, and what are some of the other areas where they are providing support to the Ministry of Health to ensure that there is surveillance. We will get into our discussion tonight, and I will start with you, Mr. Francis, as it relates to SLASPA's role. SLASPA is a very key agent in all of this discussion, and you would have been listening to the discussion, you would have been listening to the debate, to the talk shows. Never mind that most of it is fueled by fear, because we fear the unknown. Many of us are not too sure, or we are not too confident in what is being said as to how it is being spread, and so we are calling on all agencies to account. What exactly is SLASPA's role as managers of our air and seaports? What would be SLASPA's role in this current situation and in ensuring that there is a presence and certain steps have been taken to secure our ports?
Indeed, JD, SLASPA is a very important agency in the whole fight against Ebola. As the manager and the controller of airports, seaports on island, SLASPA does not have a lead role in this fight. We do not see ourselves as the lead agency in the fight against Ebola. However, we have a very important role to play. What we do, or what we have been doing, is partnering with the Ministry of Health and other government agencies or the border control agencies such as Customs, Immigration, in putting things together, really coordinating the response. So as we speak tonight, we will discuss a little more what SLASPA is doing, but we see ourselves more as a facilitator in the whole fight against the Ebola virus.
Excellent. And Mr. Fenelon, your men, Customs and Excise Department, from very early on in the discussion was seen as the frontline agents. And given the reports that have been in the media, there were some serious concerns as to their risk and their preparation to deal with any outbreak or any situation where perhaps someone would come into St. Lucia showing signs or symptoms of Ebola. What exactly is customs role? At what point do you come into the equation as it relates to handling, processing, and perhaps even being confronted with that risk?
Yes, I'm glad you asked this. Like Kennedy said, we are not, let's put it that way, we depend very heavily on the Ministry of Health because this is a medical situation and customs don't have those competencies. We are more concerned about the safety of our officers because in all of the other agencies at the airport, we have the most interaction with a passenger at the time of clearance. So we could be very exposed if there is some passenger who have signs of that particular Ebola disease. And this is what we want to prevent. We do not want to allow for a passenger to arrive at Hewanora exhibiting signs of Ebola and that passenger goes unchecked through the other processing points and finally arrive at the bench where my officers are. So we depend heavily on the Ministry of Health to have personnel in place to avert that possibility.
Are these systems in place? What is the level of interaction between customs and the Ministry of Health currently?
Well, we have frequent meetings. And it's a continued thing, right? It's ongoing because we're in a state of continuous improvement. Again, what we really want to do is to allay the fears of the officers who interact with those passengers. I do not believe that the threat at the border is very high. My research has shown that there have so far been no border agency employee who has contracted Ebola. And that just shows you that the risk at the ports of entry in itself is extremely low, extremely low.
Yes, in fact, it has been shown that the medical agencies, the health workers, the first responders, in terms of the medical end would be most at risk. In fact, I saw statistics to suggest that 1 in 20 in West Africa are in fact healthcare workers, and given what we saw in the US, again, you had that spread coming through the end of the healthcare workers. But certainly the customs officers did have some concerns up front as to their exposure. What has been done internally to equip them, to train them, and to prepare them for that possible risk?
From the onset, when this Ebola medical emergency came, the first thing we did was to seek medical advice on how we could protect our officers and make them safe. We immediately bought the gloves, we bought face masks, and we also bought aprons, something we were dealing with for the first time. I mean, we had SARS and H1N1, and we did not go that far because it wasn't required. But this time around, we're dealing with a different type of disease. So it was very important for us to make certain that we have all the tools possible to allow officers to remain safe. But again, we are heavily dependent on the medical presence at the ports, to intervene in cases where there's any suspected case of someone who may be carrying the disease.
Mr. Francis, when we speak of the ports and we speak of vulnerability, a lot of concern has been expressed about our seaports in particular. Many individuals are saying because of the route that you need to take to come to St. Lucia, because of the length of a flight to come into St. Lucia, the possibility of someone showing up at the airport exhibiting those signs would be low. However, because of distance and time of travel by sea to come to St. Lucia, our cruise ships, our cargo vessels and so on would pose some serious concern. What has been SLASPA's role in the whole issue of surveillance in assessing that risk and ensuring that there are proper protocols in place, so in the eventuality that we may be faced with a situation, that the frontline individuals are able to respond?
Well, Gigi, I must tell you that the risk to the traveling public via sea is not a new thing. People are speaking as if the seaport is just waking up to that type of phenomena, but it's not. If you are familiar with the word pratique, it's a very old French term which means sort of a license granted to a vessel before they enter port, which essentially says that that vessel is free from any medical complications, meaning that nobody on board is suffering from any communicable disease. So vessels have, over the years, dealt with SARS, Norfolk virus, H1N1. They've always been challenged by those medical emergencies. And as a result, they have very good protocols in place to deal with those situations.
But would the response be the same, or given the situation that we are dealing with now and how Ebola is spread and so on, would there be different standards and different protocols?
Obviously, we would have heightened the response. We would have created that level of awareness because there are different implications for the Ebola virus. But basically, the protocols in dealing with any medical what we call a medical emergency or medical situation is basically to quarantine if needs be or isolate. So it may be a case where the Ministry of Health will make a decision in conjunction with other partners to either quarantine the vessel, like we saw with the Lady's Eye, which arrived here a few months ago.
Yes.
And that vessel was quarantined, and subsequently it was cleared. In some instances, you have situations where persons on board the vessel are isolated by confining them to the cabin, and which is similar to what you saw happen on the cruise Carnival Magic,
yes,
where the passenger went for voluntary isolation. So there are a number of protocols in place in the event that any passenger starts to exhibit signs of the symptoms of Ebola, and St. Lucia would have developed its own protocol in dealing with such a situation.
I want to focus on the seaports, and it is to speak to some of the concerns, because in my mind, a lot of the questions that are being asked and the concerns that are being raised is simply because people do not know. You will not find many St. Lucians occupying themselves with the daily operations of the seaports and the airports and what exactly happens.
Mm-hmm.
But given the situation now, many persons are asking, well, what and how? What would be the process? Say, for example, you're dealing with the cruise ship or with a cargo vessel. Would there be a communication process that allows SLASPA or whichever official would be that point person to pick up any issues, medical issues, distress issues, or anything that would be of concern and that would cause you to respond and to inform the relevant authorities? Or are we in a situation where the vessel would have to arrive and then there would have to be that one-on-one contact so that we can identify any concerns?
Okay, as you realize, we're in a very modern world right now, and there are a number of protocols in place for pre-vessel notification. So, for example, under the ISPS code, there's a responsibility for the vessel to notify us at SLASPA of their last 7 ports of call, and this has been happening even before Ebola. So they would send us a list of passenger names, where those passengers are coming from, their last ports of call, last 7 ports of call, and if there's any passenger on board that vessel exhibiting any signs of illness, they would have to create a medical log. That is mandatory as international requirements. There's a medical log created. Prior to arrival in St. Lucia, if any passenger is exhibiting any signs that is similar to that of the Ebola virus or say any other serious communicable disease, that information will be transmitted prior to the arrival of the vessel to the Port Health, and they are the lead agencies on that. But Customs will also get notification, Immigration will receive that notification, and ourselves. Again, the Port Health officer is responsible for boarding that vessel. Every cruise ship that comes on island is boarded.
Even outside of this heightened alert that we have for Ebola?
Every cruise ship that enters our waters is boarded by a Port Health officer alongside a Customs officer and an Immigration officer. If the notification indicates that we have a serious situation on our hands, the Port Health officer may make a determination not to board that vessel in the interest of the safety of St. Lucia. And having taken that decision, and you must recognize that that's a very serious decision.
Yes.
It's a decision that has implications for all of St. Lucia. But we believe strongly that the safety of our nationals are at the forefront of any decision making, and I'm sure the government will not take that decision lightly. So there are a number of protocols in place for notification processes, prior notification. There are protocols in place for dealing with suspect cases, and again, it is all based on risk assessment. Sometimes you have a group of persons making that decision. Sometimes the call is that of the chief medical officer. Even the captain of the vessel has a right to sometimes challenge that decision. But ultimately, the state makes that final decision, whether a vessel enters the harbor or not.
Okay. Mr. Falana, again to go back to Customs and their role and their response. As I understand it, Customs, this would be the second point of interaction for a visitor to our shores. They would first have to go through immigration. And again, I want to remind our viewers that we will be speaking to the ASP with responsibility for the immigration department, and she will be giving us a little bit more information as to what is happening right now, what is in place, and what are some of the additional surveillance measures that immigration is taking. But on the Customs end, the way I see it, Customs need to be trained to pick up what immigration may miss. Because while there is that interaction and they would be perusing the passport, for example, to pick up travel history and so on, that interaction is very limited. And so when we come to Customs, there is more face-to-face interaction, and there is an opportunity to screen that person further physically and so on. What kind of measures have we put in place so that there can be that additional screening done by our Customs officers to avoid having any situation that can be stopped at the port going out into the public?
Okay, to put that into context, let me tell you, Jadia, during the initial stage of dealing with Ebola, we took the proactive move in terms of contacting the international customs agencies. We run what we call a special operations branch of customs, especially in the south. So what we did, I instructed my lead officers to get information from the UK, the US, Canada, on flights entering into St. Lucia. Get information on passengers on that flight who may have traveled to or from West Africa. And we were very successful, because what happened was that we were actually passing on that information to the different agencies to alert them the persons who they would need to pay special attention to. And that has worked. And it needs to continue right now. I think the Ministry of Health has to make it mandatory that they provide a passenger information, especially those who've gone to and from Africa, to all of the authorities so we could be better guarded in dealing with those individuals. Because I would hate for a passenger who has visited those countries where Ebola is present, for any of my officers to be attending very casually to those individuals. I think it's a responsibility that the Ministry of Health have, and they need to take it on and make certain that the staff in the different agencies at the border feel safe. Because what I do not want to happen is for panic to draw in and then the withdrawal of customs services, happens. This is something we do not want. We averted it the first time, but I think the ministry right now, they're really doing some work. Like I said, it's a state of continuous improvement. And I believe we've allayed the fears of those persons, especially the agencies. Like I indicated to you, there's been no record thus far of any border agency personnel who's contracted the disease. So the risk at the ports is extremely low.
But apart from the risk of an officer being able to contract this disease through the interaction with an individual, the immigration and customs would also play a critical role to protect the public, those of us who are out there, to protect them in the sense that while you may interact with someone who is not yet exhibiting the signs, because remember too that Ebola, you can only transmit, you are only contagious when you are showing the symptoms. And so it says to me that customs may very well interact with someone who has Ebola and not contract Ebola, but if our surveillance is not good enough, then you run the risk of missing it at the border and this person going into society and subsequently being ill and so on. But critically, immigration would speak to what they are doing to ensure that there is this oversight. And perhaps now would be a very good time to get in the comments from the ASP with responsibility for the Immigration Department. She spoke with us earlier today and she was speaking to the sensitization and the measures that have been implemented by immigration. So we'll go to this clip right now.
The Immigration Department have been sensitized by the Ministry of Health as it relates to the Ebola virus. There are a number of meetings that have been conducted with my staff, with myself, and with the various ports of entry, namely here at Nora Airport and JFL Airport, JFL Charles Airport. We've also met with all stakeholders as well, persons who work at the airport, in the airport community, the airlines. We've all met to discuss our roles as it relates to what role we play as it relates to the Ebola virus. Since the advisory by the Prime Minister, the officers at the ports of entry have been informed as to the role that they play as it relates to dealing with passengers or nationals from Sierra Leone, Nigeria, Guinea, and Liberia. I need to inform you that persons from these states all require a visa before they enter St. Lucia. They need to apply for a visa before they can enter the state. Nationals of Liberia and Nigeria would require a visa prior to arrival. So they would apply for the visa, we do our background checks, and the visa would be issued or denied. Nationals of Sierra Leone and Guinea, they obtain the visa upon arrival. Okay, so once we can control persons coming from Nigeria and Sierra Leone without them boarding an aircraft, it is different to persons coming from Guinea and Sierra Leone. But what we have done, we've been in dialogue with the Prime Minister's office to ensure that the proper advisory has been sent to the airlines. So persons coming from Sierra Leone and Guinea would not board the aircraft to St. Lucia to be told at the ports of entry that they would be denied entry. So we're ensuring that the airlines and the travel agents are aware, are properly informed, so passengers, persons coming from these countries would not be allowed to board the aircraft to St. Lucia.
In the case of Nigeria, where that individual would be requiring a medical certificate to come into St. Lucia, I understand that they would require the visa in advance, and so there would be application for that visa. At the time the application is being made, would it now become necessary that they present that medical report be required by immigration upon arrival into St. Lucia?
Well, since they are applying for visa prior, and it is prior to arrival, the medical certificate will have to accompany the application.
So this was the ASP with responsibility for the Immigration Department, ASP Pelius, and she was speaking to the sensitization of what has been happening at the Immigration Department to ensure that they enforce that prohibition which was announced by the Office of the Prime Minister on Wednesday last week. And there is an additional security layer for individuals coming from Nigeria where they would require a medical certificate in addition to the visa that would be needed to come into St. Lucia. We're due for our first commercial break. We'll do that. When we come back, we'll continue our discussion with the Controller of Customs, who is in studio with us, as well as the Chief of Ports Police. And we will also have further comments from the Immigration Department as it relates to the training and sensitization of their staff. Stay tuned. We'll be right back after this break. Welcome back to In Touch on Choice TV. Later on in the program, we'll be taking your phone calls, and so I'm sure that there are questions that you may want to ask or you may want to add to the discussion. But tonight we are focusing on border security. Extremely important, because if our borders are not safe, and not simply in the context of Ebola, there are other threats. But tonight we are focusing on that health threat. Last week we spoke to the Minister with responsibility for health. We also spoke to the Chief Medical Officer, and we got a very good idea as to what the coordination is, what the responsibility is. Tonight we are focusing on our borders. We have in studio our Chief of Port Police. We also have the Controller of Customs, and pre-recorded we spoke to ASP with responsibility for immigration. And she spoke to the measures that are currently being taken by the Immigration Department. Mr. Francis, I want to speak to the interaction, engagement, and preparation of the staff. This has been a very present issue and a very active issue for the Controller of Customs, because the staff recognize that they are in a frontline position and are very concerned about their own safety and any likely threat. In terms of SLASPA, I note and I understand that there is not that much involvement on the front line. However, is there that level of concern from the staff? And if there is, do we have any training that is ongoing in terms of the provision of PPE, whether it is even required, whether it is in place, and what exactly is happening on the human resource side of SLASPA?
JJ, I must tell you that our staff are equally concerned. They may not have made their concerns known. They make it known to ourselves internally. We recognize, and again, this is something which is stressed by the World Health Organization, the need for information to be provided to staff at points of entry, staff that are involved in the medical field. They need to know what is going on. And it has taken us a little time to get to where we want to get to, but the important thing is that we want to get this right. And we've had a lot of dialogue with the Ministry of Health. We continue to have dialogue with a number of other agencies. So we've started to focus on those agencies and customers that are at the forefront of dealing with the virus. So for example, we have caused the interaction to happen between the Ministry of Health, the airlines, the airline community, those persons who deal with the passengers checking in, our cleaners at the airports, very important group of persons.
Yes, extremely important.
And they play a very key role in dealing with the virus. So we've caused that level of interaction to happen. What we have done for our staff is we've used our electronic means. We have a electronic communication system at SLASPA called iAccess, which gives staff an opportunity to access information directly through the use of the computer. So we've put we've put in information, starting off with some very basic information, because you also recognize too much information can be a bit dangerous. Yes. So we've given them the very basic of information. We intend to, SLASPA has also put together a special committee to deal with managing the Ebola virus, because you recognize we have the seaport arm of things, we have the airport side, we have our marketing and product development team So we want to put all of those managers together to ensure that we have a well-rounded team to deal with the management of the Ebola virus, because we want to have a more coordinated effort dealing with the ministry, dealing with all the stakeholders. And that team is going to very soon be meeting with staff one-on-one, walking to, say, our accounts department, all our departments, and talk to staff and tell them in real time what is going on, what the Ebola virus is about, what is it SLASP is doing, what is it the ministry is doing, and how prepared we are to deal with any situation. So we have a very comprehensive plan, and I know some of our staff are getting a little agitated, edgy, thinking, well, we're not speaking to them on the issue. But we wanted to make sure that we got our protocols right. We know that the ministry was developing its own protocols from a national standpoint.
Yes.
And we did not want to make pronouncements that we'd have to go back and do the damage control. It costs you a lot more when you operate that way.
Yes.
So we've been providing some information. We intend to provide more information, and we intend to have more dialogue with all the stakeholders in the industry. Just today there was a meeting between the organizers for the Atlantic Rally for Cruisers with the Ministry of Health to discuss real issues as it relates to acts starting in Las Palmas, Spain,
Yes.
a country which has seen its own Ebola patients as well. But there are serious and real issues there that everyone has a right to be concerned about. And I believe maybe by Thursday or later during the week, you will see probably a lot more information being disseminated to the St. Lucian public.
Mr. Fenelon, the customs declaration form, an extremely valuable, and I understand that it has always been, given what is collected on that form, given the responsibility of the customs department in terms of our security. But this form is an extremely important form because of what is captured on this form. I know a lot of it, we would rely on information that is presented by the passenger, and we're hoping that the passenger will be very honest in the declarations and so on. But even in instances where false declarations have been made, the customs department, through intelligence and so on, have been able to pick up and to act on these things. Have we seen any changes to the customs declaration form to capture information, or is it that level of interaction that we're doing face-to-face that would capture it?
Unfortunately, the form in its design did not pay that much attention to the situation we have today. That is why you find in other jurisdictions there are additional forms that have been passed out to passengers to capture particular information with reference to the Ebola. As we move forward, probably this is something that we have to give some attention. Passenger information now is key to us, and we see it right here live with this Ebola disease. The Ministry of Health, again, and I believe they have the legislative authority, you know, to make certain that the airlines and the airline agents provide that information in advance, because it's a national safety issue for us, you know. So we need that particular key agency to do certain things that they probably have not done in the past. You know, be a little more rigid in their operations just to make sure that the safety of St. Lucia is up front.
How, at this point, are we able to capture that information as to what exactly an individual is carrying, where this individual has been? I suspect now that you're saying that there are no adjustments to the forms and so on, then we would have to rely on heavy face-to-face interaction between the customs officer and the individual.
Yes, the customs officer would get that passenger history basically by asking the questions, or in cases of those passengers who come in using a passport, to peruse the passport for the information. But again, that may be a little dangerous. You know, that type of information should be present prior to the arrival of the passenger. So when that passenger arrives, you know exactly how to deal with it.
Yes.
So we need to be a little more proactive in obtaining that information from the passengers coming
even
into
before
St.
the
Lucia. That
person
is correct.
arrives on our
Yes.
ports. The quarantine and the quarantine rooms or isolation rooms, or where we remove people from the general population on the airports and on our seaports and wherever. Do we have these rooms on our ports, and are these rooms ready to receive any emergency related to Ebola or any contagious disease for that matter?
Yes, we do. Back when we were dealing with the SARS issue, SLASPA made a significant investment in building under the guidance of the Ministry of Health, we built that port health facility at George F.L. Charles, which is currently utilized by the nurses, as you would. Although when you asked Mr. Fellner about the transformation of the form, but I wanted to also add that the Ministry of Health does capture information on passengers who have visited those
Through Port Health?
through Port Health.
Okay.
So whereas Customs may not be doing that, but the Ministry of
There
Health
is that layer.
is doing that. They also have another layer with the hotels, and as well as all the businesses that do very direct relations with the West Africans. So for example, you saw where they did that interaction with the religious community,
Yes,
and they also do it with the heavy
offshore
presence of
medical
the
schools.
medical schools.
Yes.
But at both of our airports, we retrofitted at Muranora a room to be used for Port Health.
And so as we speak,
Yes.
there is a room that would be the holding area
That
if
is
there is
correct.
a
If
situation.
needs be. And there's also the Ministry of Health has really made it, has really gone out to ensure that there is a Port Health presence at both airports.
What about our seaports?
The seaports, as you know, like I said, they've always had a Port Health presence, but they come and go based on, the level of seaport traffic. We have flights more on a regular basis at airports. So the Port Health nurses will come and remain for the duration of our port operations.
There has been some concern and a question asked as it relates to our cargo. Many individuals have said the Prime Minister has now announced a prohibition on any individuals, nationals coming from the West African countries, and there is an additional screening that is happening right now for all passengers, because there may be individuals who perhaps are British, but they have traveled to that part of the world in the last month. And so immigration, they are trained to pick this up and to do the screening and to do the monitoring and all of this. But our cargo, the question has been asked, what about cargo coming from West Africa? Is this a far-fetched question, or are we in the reality where we may very well have direct trade from that part of the world and St. Lucia?
No, I would not say that it's far-fetched. However, we do not have direct trade with any part of West Africa. We do not have any direct flights coming from West Africa. But we're not to be fooled by that, because we know very well that persons can circumvent the whole way of traveling. It's a very fluid and global world that we live in.
Small world.
So we're not fooled by the fact that we do not have direct trade, but it is very comforting to know that we do not have.
Right.
So in terms of cargo operations, again, every vessel that operates on these waters are guided by protocols that they must observe. And even the cargo vessels, I bring you back to Lady's Eye, is a cargo vessel. They had a medical emergency. The national protocols kicked in. We had not even heard of Ebola as yet, and the Lady's Eye was quarantined. So, there are a number of protocols that are already in place. The Ministry of Health is working in conjunction with a number of international agencies, such as the World Health Organization. If you go on the ICAO website right now, the International Civil Aviation Organization, they are partnering with World Health Organization. IATA is partnering with World Health Organization. IMO is partnering with World Health. So if you go on any of those websites, there's no shortage of information to help you in developing your own local protocols. And that's what we've been doing.
We will now hear from ASP with responsibility for immigration, ASP Pelius, where she will speak on the sensitization that has happened with the immigration staff. Again, they are that very first point of contact with passengers, and so she speaks to the risk, the sensitization that has taken place with her staff and some of the other areas of focus to ensure that they are able to identify any risk and to report to the relevant authorities. What kind of sensitization and training has happened with the immigration officials?
Well, of course, we are quite concerned about, I'm very concerned about my staff because, of course, we are frontline people, frontline. What we have done, as I said earlier, we had a number of meetings with the Ministry of Health. There have been meetings with our staff at the airports and also members at the mid office. So they have been properly sensitized about the Ebola virus. What we've done as well is we made things clear as it relates to what are our roles and what action we take if we were to be at the port of entry and we were to receive a call that someone is coming on an aircraft with the Ebola virus. We've made it clear that the officer who first receives the call would know exactly what to do with the information. If it is coming from the airline, immigration will be informed. We inform the port health nurses and we inform the chief medical officer so they could send their team to further assess this person. If the call is coming from the port health officer will inform us, customs, and of course the chief medical officer, so the screening can continue.
So there is dialogue.
So there is dialogue, yes, with the different agencies, and we know exactly what role we play. Also, our staff, I've spoken to my staff as relates to what they do, personal hygiene, how they deal with the passengers. We've supplied them with gloves, we've supplied them with hand sanitizers, so they could disinfect their working area, the booth, make sure they avoid contact with the passengers. When they deal with the passports, wash their hands. So we do that to make sure our officers are taken care of, not to forget, it's always in their minds that Ebola is a serious disease, so they have to be careful how they take care of themselves, their hygiene, and their working space. So we know essentially what we do when we deal with the passports. We know what the persons we contact if we were to receive a call from the airline, and we know exactly what happens to the passengers, how we deal with them. So apart from the Prime Minister's advisory on Wednesday last week, where we are told to prohibit nationals from these 4 African states, we also know that we need to peruse the passports carefully. So persons who are not nationals of the 4 African states, but have visited these states in the past month, would know that having arrived at the port of entry, going for their passports, if we realize that based on their travel history they have been to any of these states, we'll send them to the port health nurse for further screening. So it's not just a matter of dealing with persons coming from persons who are carrying the passports from the 4 African states where the virus has been detected, but also we are taking the additional responsibility to peruse all passports to make sure that we can take note of the traveling history and these persons could be further screened.
That was ASP Crisita Descat Pelius. She is responsible for the Immigration Department and gave us in detail what the responsibilities are and how the Immigration Department is going about ensuring that we have an implementation of that order that was given by the Prime Minister, as well as the additional screening and the additional security that is necessary to ensure that individuals who have a travel history in that part of the region are flagged and are treated appropriately to ensure that they are monitored, and if in fact they happen to be carrying the virus, that they are contained and that the situation is reported to the relevant authorities. We have heard from SASPA, we have heard from the Customs Department, we have also heard from Immigration. Now is the time to hear from you. I know many of you may have questions that you want to ask. We may have not covered all of the concerns that you have had. This is an opportunity for you to call into the program to ask whatever questions that you wish. You would now have our telephone number up on the screen, and so if you have any questions for Mr. Francis, who is from SNASPA, we also have Mr. Felonor, who is our customs, who is our controller of customs. you can call in. While we do not have a representative from immigration in studio tonight, the information that was given was very clear, and if we need to reiterate, I'm sure that the two officials here can do so. We'll take our first call. Good night, and thank you for calling in touch.
Good evening. I would just like to say
Hello, good night.
Hello, good night.
Good night.
Yes, I'd just like to say that I tuned in very late, but your topic is quite interesting.
Thank you. Caller, if you can just speak a little louder, please. I can barely hear you.
Okay, all right. You hear me now?
Yes, yes.
Okay. So we all know that Ebola is something that the world is facing right now, and it's imminent. In St. Lucia, I can only say that we are waiting, because it's come to a point where I feel St. Lucians have recognized it's not a if but a when. And tonight on the news we saw the Nurses Association a little uneasy. They are a little uneasy when it comes to the Ebola epidemic, and they are supposed to be the first responders. So let me just take the time to say that I don't believe that we are sensitizing the nation enough about that.
Well, you have one such show, which is what we are doing tonight, to
All right.
sensitize the public as to what is happening in terms of our border security.
Yes.
It is extremely important that we deal with that entry, because Ebola really will not drop from the sky. We have to focus on the point of entry and how individuals will come into St. Lucia, because in order for the nurses and so on to be in contact with them, they must first come through the ports. And so this is a very necessary discussion. Last week, I'm not too sure if you saw the program with the minister and also the chief medical officer speaking on the role of the Ministry of Health. But tonight we are focusing on our border security, our airports, our seaports, our immigration officials, and what they are required to do to ensure that we have that layer of protection and what is currently happening. Indeed, I have seen the concerns expressed by the Nurses Association, and so an appropriate response would have to come from the Ministry of Health as to what the level of interaction is. We've heard from the officials on the ports that we have port health authorities, that there are nurses stationed at the airports and the seaports, and so if there is any situation, there will be a response.
Because the reason why I say that is in the past, when it came to the chikungunya and the dengue disease, there was a great deal of sensitization on the television. You got on the
Yes.
radio,
Yes.
and you also got with businesses where I work. We got a pamphlet on these other things. But
Yes.
with Ebola, it is sort of like this alien kind of disease that no one. I mean, we are tackling it by organization. But when it comes to sensitizing the
There
masses
has
and
to be,
sensitizing
yes, I agree.
solutions about the disease itself,
I
what
agree.
it can do, and what if by chance it reaches on island, how we can protect ourselves, help each others out in society.
Yes.
I feel that is lacking. And
I agree that more needs to be done in that area. Thank you so much for your contribution, caller. And indeed, I agree that there has to be this mass sensitization and engagement with the public. We'll take another call. Good night. Thank you for calling in touch.
Yeah, good night.
Good night.
Like the caller, I am agreeing that there should be some sensitization, like
Yes.
as to what to do in case Ebola comes to the shores. But I also want to take time to thank the government and the ministry for putting the information out there. If somebody says that they do not have the information, I think they're listening to the wrong sources. The government website, the information about Ebola and the preparedness of the island was right there. Last week, I had the honor of hearing the CMO and the Minister of Health speak about it, and this week they spoke about ports of entry. So I don't know what the government can do to actually get people to take in the information. Because apparently what is happening out there, you have a small minority of people just spreading panic and trying to neutralize or cancel everything that is said and done by keep asking, what is the government doing? What is the government doing? But from what I see, from my viewpoint, I can see that the information is out there. And it just people need to avail themselves or people just need to listen to the right sources. Thank you.
Thank you so much. Indeed, where you get your information is very critical, and not just in the local context. There is a wealth of literature, opinions, photographs, fairy tales, you name it, on Ebola. You just type in EB and so many stories come up as to what exactly it is, how it is spread, and so on. And so I would have to stress that point that the caller makes. It is extremely important that you know your sources, that when you are taking in information, that you understand that this is an authority on the matter, someone who is involved in the matter, someone who actually knows what is happening. Because I am sure both of you would agree, when you listen to the discussion, internally and from the public at large, there is a lot of panic.
Yes, and I think too that some of the panic is being driven by what persons have seen in terms of what Ebola can do. But I must say that the Ministry of Health has had their work cut out for them, and they've been focusing primarily on the first responders. So making sure the fire service has a protocol in place, making sure the airlines have a protocol, SLASPA, customs, immigration, all those key response and border control agencies, they develop that protocol in conjunction with the Ministry of Health. So if, God forbid, it comes to our shores, these persons will know what to do. If the captain of an aircraft calls into the tower to say, we have an Ebola case on board, what is the control tower supposed to do? So once, I believe that by the end of this week, there will be a lot more information available. And I think that the ministry, as well as the government of St. Lucia, the Prime Minister, will probably address the country on these issues.
Very, very
I honestly
serious,
believe so.
very, very serious threat. Good night, thank you. We have lost that call. You continue to call in at 452-7347. Good night, thank you for calling in touch.
Hi, good night, Jadia.
Good night, how are you?
Good, good. Beautiful show. I must admit, informing the country as to what's going on. Let me just ask a question. Sometime last week, I heard one of the media houses say that, because a caller called to the show and said, well, why are they not actually going into those different places like SLASPA to find out exactly what is going on? But the talk show host said it's so difficult for the media to get to those places. I'm going to ask the gentleman representing the ports, is it difficult for the media to actually get to see what is going on? Because the talk show host made it appear that it's the most difficult thing to try and get into SLASPA to see what is SLASPA going on. And I don't think SLASPA is in a position to deny information like that. So I'm actually putting you on the spot there to find, to either correct us or guide us properly. Is the media barred from what is going on within your different sea and airports?
Well, Carla, if that were the case, I would not be here tonight. I mean, my presence here tonight is an indication that SLASPA is willing to share with the public whatever needs to be shared. What I can tell you is that from the very onset, SLASPA has been working very closely with the Ministry of Health, with all the other border agencies involved, Ministry of Tourism. There are a number of other ministries, just not health, but there are a number of other ministries, government ministries that are involved. Tourism, national security, so many of them.
Yes.
And we've been having discussions with as many of those ministries. We will continue to partner the ministries, work in partnership. There are times when SLASPA will call those meetings. There are times when we are called to meetings. So we've been, I don't know that any media house, SLASPA has a marketing and product development department which is responsible for communications both internally and externally at SLASPA. So anybody who wants to get the SLASPA side of things, you go directly to, we have an entire department for that.
You're better than me. You have an entire department, and I have to run this ship solo. And I understand, because I heard some of the comments that were being made, and it seemed as if there was apprehension to interact with the public through the media and to give that information. And you will understand that this is critical information, quite apart from SLASPA having to hold its own internally and customs having to do so internally and immigration being, you know, the public needs to know to get that assurance that something is being done. And so I am sure that you would have heard some of these concerns as well, but I'm very relieved that you're saying that you have not barred the media from coming in to speak with SLASPA to let them know what is going on, because it would have been very unfair that you have decided not to speak to the rest of the media and you're speaking to a pseudo-journalist like me.
SLASPA is a quasi-government organization. That would not be our approach at all. As a matter of fact, SLASPA has always been a very open organization. I mean, we embarked on a very serious campaign a few months ago to let you know what we were doing. We've been very open with a number of things relating to whether it's airport redevelopment.
Yes. So even outside of the Ebola and all of that, there has been that interaction. We continue to take your calls at 452-7347. We have a caller on the line. Good night. Thank you for calling.
Good night, JD. How are you?
I'm doing good, thank you.
And good night to your guests.
Good night.
Good night.
All right. JD, I mean, listening to the talk shows, I mean, on a daily basis, I got the impression that the government was sitting on its haunches doing nothing.
Caller, I'm not hearing you very clearly. I'm sorry. Can you just speak a little louder, please?
I said, listening to the talk shows on a daily basis,
Yes.
I got the impression that the government was sitting on its haunches doing nothing in the fight against Ebola virus.
Maybe I must tell you, like one of my earlier callers say, that you're listening to the wrong sources. Maybe this is what it is. It is real, and I agree with you, and this is why I insisted tonight that I would do every single thing in my power, which included walking physically in the sun to get the information, to get that interview so that we can know what immigration is doing, because the public needs to be informed, and I was confident that enough was happening that would have satisfied St. Lucians that the government is on top of the situation, is monitoring it, and there are protocols in place.
Yes, yeah, and you've done a good job of it, because I just realized, I mean, by listening to the public officers articulate, you know, their position as far as preventative, you know, measures are concerned, you know, I see we are, let us say, almost ahead of ourselves in the fight against Ebola. You know?
Yes.
And I have no fear, to be honest with you. I mean, I have no fear that we can handle this thing if it reaches our shores, because I know that we have no direct flights coming from the African countries. Okay? They have to go to the U.S., to Europe, and the other countries, you know, the international countries.
Yes.
Of course, there will be checks, there will be quarantine, you know, before any of them can get to St. Lucia. You know? So I really don't understand, you know, why you spreading all that fear, you know, in the citizenry of this country.
Well, caller, you must admit it's a very good story.
Yeah.
Yes, thank you so much for that. Thank you so much for that, caller. But again, the source of your information is extremely important. On this program, our aim is to inform you. We really cannot formulate your opinions. We cannot make up your minds for you. I cannot tell you what to believe, but my responsibility is to feed you with factual information, so that at the end of the program, when you decide to listen to whatever you listen to in the morning, at lunchtime, or in the evening, that you would have had an authoritative source in the persons of the representatives that we have here tonight, and you would be able to discern the fact from the opinion, from the panic, and all of what is happening out there. So once at the end of this program, you have been informed, and you are now in a position to separate the reality from what is being fueled for whatever purposes, political or otherwise. Once you're able to make that distinction, then it would mean that I have, you know, held up my responsibility to the public in terms of giving information. We have another call on the line. Good night. Thank you for calling in touch.
Hi, hello, good night.
Good night.
One of my main concerns concerning that Ebola spread, I haven't heard nobody really said anything about it. Remember, we have illegal points of entry where people tend to come in our country unsuspecting or, you know, without papers and that kind of stuff.
Yes.
I would really like to know what they really have in place or in order for those things. That's all I have to ask here.
Very important question and observation, and we have our our director of Port Police here, and so I think this question falls right into your laps. Monitoring, surveillance of our borders, of our waters, to monitor illegal movements, because quite apart from the other risk, it is very real that you may have that Ebola threat there as well.
Some of the arrangements that are in place for monitoring, we may not be able to speak openly about here.
Obviously,
but
yes.
I can also indicate that there is monitoring happening of all craft on the waters. That's not new to the persons who partake in illegal activity. They know of it as well. Just tonight, you heard of the arrest of a fugitive
yes.
from the law,
Yes.
and I'm sure that arrest on high waters did not take place without monitoring.
Yes.
So
So that should give us a certain
yes.
level. At least we know that our officials are aware of that threat and are continuing to monitor for reasons that we are very much
Yes.
concerned about as well. But I really must thank that caller for asking that
It's
question.
a good question.
Yes.
But I wanted to add as well, Jadia, that all of our monitoring will not capture all of the illegal activity. And that's where people like our caller comes in.
Yes.
That they must make those things known
Yes.
when they
If
are
you
aware
have
of it.
information,
If you have
if you know.
information which is going to put your family and the rest of St. Lucia at risk, that you should share it with the necessary authorities.
Very, very important call. Good night. Thank you for calling in touch.
Hi, good night.
Hello, good night.
I think I heard that there's a nurse, the nurse who treated one of the gentlemen that died in America, that this nurse is a St. Lucian lady. Is she a St. Lucian lady?
Well,
We're learning like you.
Yes, this is the first time. This is the first time I'm hearing this caller. I saw the information on the American media. I saw the name. It did not ring a bell. I've not heard any official sources indicate that she's a St. Lucian. So I really cannot speak to this at this point.
Okay, because I understood that she's a St. Lucian lady, and I'm wondering what are we going to do in a case like that?
You mean what protocols are in place in case you have a St. Lucian coming home with Ebola?
Exactly.
Oh, thank you. Thank you for that. Very real. And in fact, I spoke to the immigration officer about that.
I don't know that we can prevent any national from coming home. As a matter of fact, we turn persons that are non-nationals away if they don't meet the entry requirements. But for a St. Lucian coming home, we would not turn away our own national. And there are protocols in place for dealing with anybody who is coming in exhibiting signs of the Ebola virus. All the necessary protocols will kick into action. The PPEs will come out, the mask will be worn.
And even though we have not seen the PPEs on Choice News and on DBS and on HTS, the PPEs are there.
Yes.
We have PPEs.
The PPEs will come out.
And as the head of SLASPA's disaster management and as our director of Port Police, you are saying that the PPEs will come out because you know that the PPEs are there.
Yes, the PPEs will come out, and there will be, the protocols will be observed for the transfer of a patient from an aircraft to a medical facility. The necessary lab work will be done, and the necessary protocols will be implemented by the Ministry of Health.
I think now would be a very good time to inform our viewers as we speak to the risk that is associated with our own nationals traveling. And this is a question that I had to answer today because one of the media reporters came to me asking what exactly is in place. There is a travel restriction that prevents the entry, but you have your nationals going out. I also saw a story online which suggested that the travels of our government ministers may very well put the nation at risk. I wish to inform the public that the government of St. Lucia has assessed the risk associated with travel to the Western African countries. So just as the government has implemented a prohibition on individuals nationals coming from Liberia, Sierra Leone, and Guinea the government of St. Lucia has taken the official position that no travel will be sanctioned, will be authorized to this country. So our government officials, Prime Minister, Minister for Health, Permanent Secretaries, Deputy Permanent Secretaries, Director of our Port Police, our Controller of Customs would not be allowed to travel to these parts on government business. There is that much that the government can do as it relates to our private citizens and their leisure travel. You cannot say to someone who is not in prison, someone who is not bound by law to remain in the country, that you cannot travel to Nigeria and you cannot travel to this place. This is your right as an individual. However, the Ministry of Health has protocols in place to sensitize these individuals and to inform them of the risk associated with their travel. Upon your return to St. Lucia, you will be subjected to the protocols, you will be subjected to the screening, you will be subjected to the quarantine, isolation needs be, whatever needs to be done to ensure that you're monitored for that 21-day period and that St. Lucia is safe. It is already in place and it will be done. And so the Prime Minister cannot say to an individual who is planning to go somewhere for whatever reason, I forbid you to travel to so and so. However, what we have done on our end as a government is to put the measures in place that if you decide to go at your own risk, that you do not put the country at further risk upon your return. And I think it was very important to clarify, because I did see a story where someone was expressing concern that our government ministers and our government officials may be putting the country at risk through their travels. And so that we needed to clear. And you heard the immigration officer indicate that while we speak to the nationals, there's a very real possibility of an American, of a British, of a Bayesian, of a St. Lucian coming in with that travel history. And so that is very important as well. We will continue to take your calls. Good night, you're on the air.
Yes, good night. What's up?
I'm doing good. How are you?
Yes, not too bad. Not too bad. Okay. What I've heard so far makes reference to vessels that will be monitored by SLASPA and customs, vessels that will be coming in through the right channel. But like a caller called a while ago talking about ports of entry, which may be,
illegal. Don't be afraid to say it.
Not sanction.
Don't be afraid to say it. Yes.
They're not ports of entry.
Illegal entry into the country.
No.
They're not ports. They're not declared ports.
They're not ports. They are created by those who are involved in legal activity.
Okay.
My point is, there are other agencies that are actually involved, and they would be involved both with persons who are entering through the right channel and those who are entering for the wrong channel.
Yes.
But there seems to be very little in terms of sensitization with these agencies.
Well, it's a matter of national security,
yeah?
Yeah.
What more has to be done?
Thank you. Thank you so much for that caller. And a while ago you said that too much information is dangerous. When we are dealing with matters of national security, monitoring and interception and so on, I know this is not my place at all. You have been involved in this matter as our Chief of Port Police for a very long time, and I'm sure you know what to say and what not to say. So
That's
this
correct.
one I will hand squarely into your hands. We have another call. Thank you for calling in touch.
Yeah, pleasant good evening, JD. Good evening to you, both of your guests.
Good evening.
And a point of correction on the carry you just spoke to a clip that was aired on news, but basically what I understood what the individual.
Which clip did I speak to that was aired on news?
What you were just speaking about just moments ago.
No, it was something I read.
Caller.
It was something I read. Not did I say I saw it on news, because I didn't really get the news tonight.
You heard? You may have heard.
No, it was something that I read.
Oh, read.
Yes.
Okay. Well, basically, what I gathered from that is that government ministers, they carry a diplomatic passport.
Yes.
Right? And what I gathered from it, they carry diplomatic passports that they're not subject to being
screened,
to they're not subjected to being screened. People, officials, military officials, so they don't go for a screening process. You know now, because Ebola is no longer I should say,
Caller, we are losing
issue.
you.
I don't know, the call is breaking. I don't know.
Yes, I'm not hearing you clearly, but I think we got the gist of his contribution.
Yes, and I want to say
the screening.
There are various levels of screening. So he's indicating that the ministers, because of their diplomatic status, are not being screened. But again, in terms of screening, what people must understand is the screening is not the panacea of dealing with this. It is one component. So there are other components, such as your travel history. So if your travel history does not indicate, there may not be the need for screening. If the screening indicates that you have a high fever, but you've not been to a place where there's a presence of Ebola, or you have not cared for a sick patient which probably had the Ebola virus, then you still have not come to the end of the screening process. So then the ministry will decide whether there is a need for further screening, whether you need to go to a medical facility,
yes,
or whether we are going to now instruct you to do the self-monitoring, which is going to happen at home. You will continue to monitor yourself. Make sure you don't develop a virus, a fever, don't have a temperature, and you're not exhibiting the other symptoms. If you are, then there's a protocol which advises you what to do, who to contact, and to come in and whatnot. So the screening is a layered, multi-layered approach.
From what this caller has said, and I know from what a lot of persons think, they believe that once you hold a diplomatic passport, that you have carte blanche, that you can just walk through JFK, nobody would ask you a question, nobody would do any checks, whether they be physical checks or machine checks and so on. I've traveled with the Prime Minister, and I can tell you, with all of his status as Prime Minister of St. Lucia, and that maroon-colored passport that he carries, he is subjected to security screening. The Prime Minister may not be on the same line as you, but the Prime Minister does not walk in and out so freely as if he's going into his yard. He too is subjected to screening. Any holder of passport, the conditions are different, the place he is screened may be different, but the Prime Minister and every single minister of government and holders of official passports are screened too. Am I correct, Controller?
You're certainly correct.
Okay, I just needed to be sure that I was not making this up for PR purposes to make the Prime Minister look good, but I was in fact speaking to protocols that are in place. And I'm speaking to what I have seen. Good night, thank you for staying in touch.
Yeah, good night.
Good night, how are you?
Yeah, good night. And you other guy, forget his name.
Good night.
Mr. Francis, Kennedy Francis.
Mr. Francis.
Sir.
Let me tell you something about man. We're not living in no perfect world, okay, my brother?
Yes.
We have so many hosts of entities that can come into St. Lucia.
And very much aware.
You have a few marine police boats. When, before uncasted, right? When they go and pack, when they go and pack at night, we have first coming into the country over. Anyhow, you know. Now, you talk about morning terror. Let me give you a simple scenario. The safest street in St. Lucia, we all know, is Social Road, right? Look at the amount of cameras they have. Things happening there daily, night, bagay. People getting killed, people getting robbed. What have you heard? You up there, they can't hold nobody. Are you telling me St. Lucia is 2 square miles? We have committee to where we can enter at night. Any police are them sleeping in their bed. You telling me you have one? Okay. When police hold somebody, it's because they have a good tip off it. When customs do a busting, it's because they have a good tip off it. So how many things have you had police? How many times you have police out there? Now, the first of the police, customs and marine are supposed to work hand in hand. Isn't that so?
That's correct.
Right. So if one feels, you are supposed to work, of course. That time, it happened already. First, sending police on wild goose chase, saying, yep, something happened up there, just for us to enter in. When all police went up north, things come in the south. So remember, we don't live in the perfect world. Things are going to happen, but you have to put things in place and in check.
Yeah. You're very much aware how it works.
But
and you must call when you have the tips. You must call the police, call Mr. Francis, so that we can have the systems working in coordination, and we can have a lot more happening to deal with that very problem that you've raised. And it's a very real possibility.
Yes, because it did indicate we do not have all of the resources. St. Lucia is a very small island state. We will never have all of the resources to deal with the multiplicity of issues that confront us, crime and the like. But with the help of the public, we can make a very good dent.
Yes, indeed. And so there would have to be that collaboration between the public, between the government agencies and so on. What we have heard tonight in terms of the response, and given that we spoke to the minister last week with the chief medical officer, and we're now speaking to the port agents and authorities, what we are seeing is a collaborative and interactive approach, ongoing approach that would cause certain things to work together so that we can get to where we need to be in terms of our preparation. We have lost that caller, but we continue to take your calls at 4527347. Good night, and thank you for staying in touch. Hello, good night.
Hello, good night, miss.
Good night.
What I'm about to tell? What about the people on the yacht?
Okay. The people on the yachts.
Yes. I did indicate earlier that we have, for example, Marigot Bay as one of the 5 major points of entry that we are focusing on. We have the Atlantic Rally for Cruisers coming up pretty soon. And like I indicated earlier, the ministry met with the organizers of the race. AC is also meeting, the AC committee is also meeting this first day to further the discussion. So there is quite a bit of discussion.
And SLASPO would be involved and would be part of this process in terms of monitoring.
Yeah, we have responsibilities, not just in terms of monitoring for Ebola, but we have always been a part of the AC race.
And monitoring for all other possibilities as well.
One thing I want to add is that with customs, we have what we call a sail clear system, which allows yachtsmen, captains to actually make a declaration to customs even before they arrive.
Okay.
So that information we could utilize to decide whether there's a risk to anybody coming in.
So that is one of the instances where we get information beforehand,
that's right.
so that we are able to deal with any possible risk. We continue to take your calls at 4527347. I must say our callers have been on point tonight. They are asking the right questions, things that we have overlooked. They are bringing to the discussion so that we can focus on areas where there are very real risks, and that there must be oversight to ensure that we protect our borders, not just from Ebola, but from some other threats as well. Good night, and thank you for staying in touch.
Hello?
Hello, good night.
Yes, good night. Good night, Julia.
Good night.
Everything is said in English.
You want some Creole? We can do that. We can do that. Thank you so much for that caller. I am loving my callers tonight because they have this thing on point. So no kai parler si me yet Creole.
What's up, comrade? Moi pas dire fort.
Ou ni pour faire travail libalia parce que nous voulons et puis ça bon parce que ça c'est un bagage qui est important. Et puis nous voulons tout le monde comprendre qui ça gouvernement qu'a fait, qui ça SLASPO qu'a fait, qui ça customs qu'a fait, immigration qu'a fait, pour nous ça assurer que si l'année pièce et c'est de Ebola nous kay ni une réponse qui kay essayer minimiser parce que nous pas ça nous pas ça quand c'est mon jardin que nous a dit en anglais nous pas ça une situation côté si un monde ka vini toutes les nous savons y l'année Saint-Lucien ka vini aussi so dis-nous en créole qui ça qui en place pour nous manager risque Ebola Saint-Lucien.
Et quand nous depuis bon nous sommes en situation côté depuis affaire Ebola a commencé nous en SLASPO pas joindre souvent avec ces gens médicaux là ces docteurs à ministère nous a joindre aussi et puis custom immigration c'est mon qui travaille avec Plénance ces gens sur les portes là enfin tous ces gens qui ni à bail pour faire puis moun qui vient dans pays tourisme nous a joindre puis tous ces gens là et puis ça nous a fait c'est quand ces gens qui tué nous a aussi vers information hot di pays pour yo ka sorti ya. Kou moun ki ka vini. Ki problème yo ni? Est-ce que yo ni maladie? Est-ce que yo ha tombe malade tant yo ka atwe en pays ya? Et puis là yo arrivé, yo ka jwenn et puis en os. Nous ni nos qui présent dans tous les aéroports qui ka jwenn et puis yo qui ka demander yo question, qui ka ba yon ti forme pour plein, pour ba information pour est-ce que yo ha les Afrique, West Africa,
Liberia,
Guinea,
Sierra Leone.
Et si on a les en ces places-là, et bien si on a toutes les personnes qui étaient malades depuis Ebola, then nous ne savons pas ça pour faire. Mais nous n'y en place pour si en situation qu'on a trouvé quoi ici, pour nous savoir exactement qui ça nous va faire.
À sous affaires équipement. Slash pas ni équipement et puis c'est l'autre c'est mamla qui évolvé ni équipement pour nous ça garder à des affaires ça.
Slash pas ni équipement et nous avons acheté pour parler et puis l'autre agence pour nous acheter plus équipement parce que nous réalisons que even c'est mon qui a venu nettoyer chambre là côté mon qui était avec Ebola ni pour ni équipement aussi et à part des équipements pour ménager Ebola, nous avons mis en place pour assurer que les gens ne pas joindre. Quand laver les mains souvent, ça c'est qui a aidé en chai. Nous avons demandé tout le monde qui travaille sur l'aéroport, qui a joindre un travail touriste, laver les mains souvent. Ça, il pas ça dit ça plus passer ça. Laver sous pas ni globe pour laver les mains, servir hand sanitizer. Mais servir un chai savon et laver les mains souvent. Ça qui est très important.
Et puis ministre qui a joint et puis sport et puis customs et puis immigration tout les
joint et puis Jean airline, Jean tourisme, customs, immigration, tout le monde pour mettre tout bagage en place pour assurer le pays que si Ebola vient ici, nous savons exactement ce que ça peut faire. Nous
pouvons réponse. Merci Appeal. Good night and thank you for calling in touch.
Yes. Oui. Est-ce qu'il y a chose qui m'a dit African snail dans notre pays?
African snail.
C'est la moyenne. Parce que j'ai des jeunes boys qui ont bridgé, fait chien, mais chien tu c'est des pitbull comme chien qui ont arraché ferocious. Est-ce qu'il y a chose qui m'a dit c'est ça là tu et par contre pour physique, all fall down. So, most minister pour ça là aussi because ils ont pas qu'à sortir.
Et on est pour changer aussi, des pour les pièces information. On est pour couiller
police là,
bio information. Pas dire trop slow parce que même si vous pointez temps, il est important pour vous donner information. So peut-être qu'il dit eh ben c'est un chien, il pas qu'à faire rien. Mais là ni l'autre bagaille qui là où est un chien. C'est pas un chien seulement ou ça. Yo do depuis là ni la famille là ni dit fait. So il est important pour nous ça bail police information pour yo ça fait ça yo ni pour faire pour assurer cette ici c'est en place qui pas ni c'est quand c'est problème crime ça nous ni à besoin. Mais merci merci pour ça. Very, very important point.
It's a very serious issue. We are not going to remove ourselves and play blind that those things don't exist. But the important point, JJ, is that the Ebola, the response is going to be a national response. It's not a SLASPA response. It's not a customs response. It's a national response. And at some point in time, we all will have a very important role to play. So it's important that the caller understands that like he said earlier, we don't live in a perfect world.
Yes.
And we have to deal with things.
I will ask you a question, and we are nearing the end of our program. But last week, the Minister for Health made a comment on the program. And she said that the ministry has been so consumed with Ebola and the response to Ebola that there are some other initiatives in the Ministry of Health and other issues that would be affecting us. For example, we have chikungunya. We had an imported case of malaria and so on, that the resources are so focused on Ebola that we may be overlooking some other issues. The issue of security, and I say this too, particularly for our control of customs. While we focus so much on Ebola, some individuals may say, well, everything is Ebola now. So that illegal firearm or the cocaine or the marijuana or whatever it is, they're so focused on Ebola that all customs officers care about is Ebola. They will take 10 steps away from me. And so are we just as focused, or are we ensuring that security in other areas is not compromised because of the heavy focus that is now being put on Ebola?
I could guarantee you that. We have not lost focus on any other prohibition or restriction in this country. Ebola is just additional, but we have not lost focus.
And so, Mr. Francis, in terms of SLASPA?
For us, it's safety and security. If you take Ebola and you put it into the category of keeping the country safe, some of the protocols that apply in the same measure. So it's safety and security. There's no deviating from it.
Then we may have time to take just at least one more call. We've lost that call, but we may be able to take another call, so continue to try. And good night, and thank you for staying in touch. Hello, good night.
Good night.
Yes.
I have been listening to the news on this Ebola issue, and I have been hearing that the persons who got infected were those who had direct contact with the persons that had the disease.
Yes.
But with all this sensitization going on, I am not too sure that I know what to do if the event that maybe a member of my family or friend shows signs of Ebola. I don't know what to do, what not to do, or what to do, or between the time I maybe seek for help, or otherwise.
A
So
very
all these,
important point.
I don't know what to do.
A very important point, and thank you so much for that. And it is something that we indicated earlier, that we have been focusing on the agencies, that those who are most at risk would have to be informed, they would have to be trained, they would have to be equipped first, because they are the most likely first point of contact. But you did give the assurity that later on during the week,
yes,
after we have covered the bases, that there would be massive sensitization of the public.
I can almost feel it coming.
Yes, and so I
will deviate to the Ministry of Health.
Yes, and so I will say to you, caller, and to our other viewers as well, it is a point that has been made repeatedly, and it is something that is very serious. The government of St. Lucia, through the government website, we have had that kind of information being disseminated. Even now, as we are doing with the program, the minister has spoken. The Ministry of Health has issued many bulletins, information, and so on. Last week, the government, through the Ministry of Health, met with the media, because the media is a very, very critical partner in the dissemination of information. We are at the point where we are dealing with a national issue. And I do not want us to mistake the word national for government. National means St. Lucia, the flag, the blue, white, black, and yellow. Everything that is within the 238 square miles will be national. And so the media has a very important responsibility to the public to disseminate information. Given where we are and the risk that is involved, really you would expect that every single media house would find it a duty to the nation to disseminate, to have advisories, to broadcast information that would say to individuals, this is what Ebola is, and these are the do's and don'ts, and this is what you do to protect yourself in terms of your hygiene. And so the ministry met with the media, representatives from the media last week. They met on Thursday, and so I would expect that this week we would begin to see more advisories, that we would get more information coming from not just the state entities like NTN and Radio St. Lucia, but also Choice TV, DBS, HTS, and so on, that the media houses too would see it as their responsibility to their viewers and to their listeners to inform them, not to the PR for the government, because I think I very well can handle that one, but to inform you, their loyal customers and their viewers, as to what the risks are. What should you do? What exactly is this virus that everybody's talking about? How is it spread? Can I get it by sitting next to the controller of customs? Can I get it, by having a casual discussion? And the answer is no. But unless you have that information, And there are many ways of verifying the information that is disseminated. For example, the media houses would know off the bat that you have the World Health Organization, a very resourceful agency that they can take information directly from and report. They do it for the news, and so I'm hoping that some of the airtime can be dedicated to that kind of sensitization. And so to you, caller, and to our viewers as well, I'm not taking government responsibility and placing it on the media. I'm saying that there has to be shared effort, there has to be shared sensitization, because the government can do that much. You can exhaust the talk shows and you would not reach everybody, because you have so many media houses in St. Lucia, and so there would have to be that level of corporate social responsibility as well in dealing with that matter. We are very much at the end of our program, and so I would like to take the opportunity to thank profusely our Director of Port Police for being here tonight. I know that given where we are right now, you have been engaged non-stop for the last few days, that it has to be that constant dialogue, both internally and of course with other agencies that you have been coordinating and been having these meetings. So I thank you for taking your responsibility to the public, to inform them, to let them know what is happening, to give them that assurance that SLASPA really is playing its part. While you're not the lead agency, but you're giving the support that is necessary to ensure that there is that response. And so I want to thank you for that, and at the same time to give you an opportunity for your final words.
Well, JJ, on behalf of SLASPA, let me also thank you for giving us the opportunity to be in touch with the public. I just want to reiterate that SLASPA takes its responsibility very seriously for the management of airports and seaports, and we will continue to partner with the necessary agencies and all our stakeholders for that matter in ensuring that the necessary information gets to the right people, so that everyone knows what their role and responsibility is in. We will be doing some more sensitization, meeting more in-depth with our own staff as well. They probably think that we have left them out, but we've been focusing more on the primary response agencies. We have our necessary protocols in place. We have the nurses and the port health officials at all our ports of entry doing the monitoring, and we are pretty confident that we will be able to, first and foremost, catch it at the borders. We're not focusing too heavily on dealing with an Ebola case. We want to make sure that we prevent Ebola from coming to our shores. And we believe that with the measures that has been instituted by the Ministry of Health, coupled with the other partners, that we are very much on the money so far.
Thank you so much. Mr. Andy Fenelor, I know that you have had the internal dynamics to manage in terms of dealing with the concerns of your officers, ensuring that your officers are confident that the matter is one that is being taken very seriously by those who have the authority to sensitize, to equip, and to train. And two, added with the responsibility now to the public in terms of security, I know too, just as Mr. Francis, that it has been a very engaging 2 months, 3 months as you prepare, as you patch up, as you you know, dealt with situations that could have possibly been explosive. I thank you too for taking time out to share with the public, to let them know what is happening at the Customs and Excise Department, to let them know what your concerns are as well. And critically, for me, to say to the public that while we are focusing on that risk, that we take even just as seriously that responsibility to protect our borders from other items and other prohibitions. And so I thank you for coming on In Touch tonight, for speaking to the people tonight, and I would like to give you an opportunity for your final words.
Yes, it's important, JJ, that we continue to have customs presence at the borders. The safety of the officers is paramount to all of us. I would like to encourage the Ministry of Health, and I know it's a tremendous task, but they're doing the right things and they continue to improve, which is important. And more dialogue with us will allay the fears of our officers in terms of the risk posed to them with dealing with persons coming through our borders.
Thank you so much. This has been In Touch right here on Choice TV, and I have thanked my guests. I want to particularly thank ASP Crisita Descartes-Pelius. She was not in studio with us tonight, but she was very willing when I contacted her this morning to tell her I believe it is extremely important that I get this information to give to you, the viewers, because of the discussion we're having tonight. When you talk about port security, immigration plays such a critical role. Customs and SLASPA, there is that much that they can do, but immigration is extremely important, and the role that they now play in capturing information, flagging and giving information to the Ministry of Health to ensure that we have a proper surveillance is extremely critical. And so I'd like to thank the Commissioner of Police. I would like to thank ASP, who has responsibility for the Immigration Department, for facilitating me earlier today so that you, the viewers, can have that information. I want to thank especially to Choice TV, because if we did not have this venue, if we did not have this opportunity to stay in touch with you, the public, then this would have not been possible. And last but by no means least, you are very important in this process as we seek to inform and to educate. And so our viewers, our listeners, our callers, I thank you for participating. This show, just as our previous shows, will be available on YouTube, and so you can search for Press Secretary to the Prime Minister St. Lucia on YouTube. And when we have uploaded the show, you can share it with St. Lucians home and abroad so that they can understand the measures that are in place and that they can see, despite what you may hear from other sources, that the government of St. Lucia is taking the Ebola threat extremely seriously, and that there are measures in place to deal with any potential threat to our borders. As we speak, our Prime Minister is in Havana, Cuba. The Minister for Health is with him as well, and they are attending an ALBA summit on Ebola. Extremely important in terms of collaboration, because Cuba, which is the host, has taken the lead on a number of medical issues. They have provided assistance to the Western African states, and currently there are 463 medical officials from Cuba deployed in West Africa. They have been trained, and they are providing a high level of support and a high level of medical expertise to the African states. The Prime Minister has indicated that he is absolutely confident that if the need arises and St. Lucia finds itself in the unfortunate position where we would have to deal with a case of Ebola, that Cuba would provide that level of support to St. Lucia and to the other allies in the region. And so it is a very, very critical alliance, and it was extremely important that as a region, ALBA had that unified response, and that everyone knows the resources and the level of support that would be available. And I'm sure even to our local agencies who are dealing with the border protection, our Ministry of Health officials, our nurses and so on, and to you, the public, that it would be quite a relief to know that there is a coordinated response, not just internally, but on the regional level as well. I thank you for tuning in to In Touch. Again, our program will be available on YouTube. We'll be back here next week, Monday, with another edition of In Touch. We'll be speaking to you, educating you, informing you on the positions as it relates to national issues, social issues, political issues, current issues. And so you have something to look forward to next week, Monday. Thank you for staying in touch. We'll be back next week.